Hello everyone, we are learning the iron homeostasis process step by step. In the first part, we learned how the dietary iron they absorbed from the acellular space to cellular space first. That means from the GI tract, how it comes to the intestinal epithelial cell. So a quick recapitulation. Uh, the dietary ferrous form does not feel any difficulty. It crosses the DMT or divalent metal transporter and it comes to the intestinal epithelial cell. Now, in the intestinal epithelial cell, this ferrous form stores as ferritin molecule. But before that, we have to know what is the fate of the ferric form in the GI tract. All the ferric form in the GI tract they convert into ferrous form with the help of cytochrome that is present in the duodenal surface. That cytochrome contains iron reductase property. So ferric form with the help of this reductase converts into ferrous form, and along with the original ferrous form they will now enter through the DMT1 within the intestinal epithelial cell. Here, for storage purpose, apoferritin molecule is already there, but apoferritin molecule allows only ferric form. So all the ferrous form now will have to convert into ferric form with the help of iron oxidase. That iron oxidase present in the cytosol. So it's very easy to convert into ferric form. That ferric form is stored within the apoferritin molecule. Together they are called ferritin. Now, when there is need of iron, the ferritin molecule releases the ferric form. The ferric form, again with the help of some iron reductase, it converts into ferrous form. That ferrous form, through the ferroportin, jumps out into the blood circulation. First in the portal blood and then systemic blood circulation. So, here this is the ferroportin molecule. This is the hephaestine molecule, or we can call it again iron oxidase, because iron again will have to convert into ferric atom. Now question is why? Why again we need to convert the iron into ferric form? Is there any purpose? Yes, there is a particular purpose. Because there are some molecule present here called transferrin. Transferrin. This transferrin or apotransferrin molecule, they can carry only the ferric form, not the ferrous form. So, a transferrin molecule can carry only ferric form, and at a time it can carry two ferric atoms. So, a transferrin molecule can carry two ferric atoms. And for this purpose, hephaestine molecule present in the basolateral surface of the intestinal epithelial cell. Now, apart from hephaestine, there are also soluble soluble iron oxidase molecule present in the blood circulation. Actually, this is present in within a protein molecule called ceruloplasmin. Ceruloplasmin is a copper containing protein, and within this ceruloplasmin there is iron oxidase activity. So we can see from this diagram there is one soluble variety of iron oxidase that is present in the blood circulation always, and there is a fixed variety of enzyme This kind of enzymes are called ectoenzymes when their catalytic site is present outside the cell. Ideally, catalytic site should be present inside the intestinal epithelial cell, but from this diagram you can appreciate that hephaestin molecule, the main catalytic site is present towards the blood circulation. So it's a kind of ectoenzyme. Now with the help of this hephaestin, ferrous molecule can convert into ferric, ferrous atom can convert into ferric, and that ferric with the help of transferrin or apotransferrin molecule now transport to different types of cell. Now which cells? The cell where erythropoiesis or formation of red blood corpuscles, there we need iron. Only there? No. Liver also needs. For hemoglobin synthesis, the erythropoietic tissue needs iron. Liver can synthesize myoglobin. Not only liver, every cell which has mitochondria, they need some they need to synthesize some iron containing protein for the proper metabolic purpose. So with the help of this transferrin molecule, through the first through the portal circulation, then through systemic circulation, all the iron now will reach to different kind of tissue. But the maximum amount that should reach to the erythropoietic tissue as well as to the hepatocyte. In both these tissue, we will need iron more in amount. But I am telling again that every cell needs the iron. This transferrin molecule, this protein, this transferrin protein actually that is synthesized from liver and that is present in the blood circulation. Now there are proper mechanism through which this transferrin molecule can give this ferric molecule to the different tissue. Coming to next slide, suppose this is a cell which want to receives iron from the transferrin molecule. On the surface of the cell, on the surface of the cell, some receptor is there. This is the receptor. On the membrane, this receptor is planted or decorated. Now transferrin molecule, they are carrying two ferric atom, two ferric atom. This receptor has speciality. This receptor at a time it can bind with two transferrin molecule. So this is transferrin receptor in which two transferrin molecule can come and bind. Now what happened? Now some clathrin coated mechanism will occur, and you know what is the process? The process is called receptor mediated endocytosis. With the help of this process, the transferrin receptor along with transferrin molecule and the ferric atom, all the three components now they are internalized. So with the help of receptor mediated endocytosis, all the three components are internalized. Now one component remains inside. Which component? The Fe3 plus molecule. The rest of the two component, that means the transferrin molecule and the transferrin receptor, they will again recycle. The transferrin molecules goes outside and the transferrin receptor again planted or decorated to the cell membrane. So with the help of this receptor mediated endocytosis, iron is internalized. Now according to need, this ferric atom will convert into ferrous atom. Like for erythropoiesis, for heme synthesis. In the center of the porphyrin ring, we need only ferrous atom, not the ferric. So again, the ferric atom will convert into ferrous atom for the process of heme synthesis. So here we conclude the second part of our discussion of iron homeostasis. Thank you for kind listening.